from pre-COVID days shows that rising patient wait time for scheduling new patient appointments had become a trend. On an average, 25% patients become no-shows. On an average, the average wait time to get a new appointment is 25 days. The higher the time lag for getting an appointment with the physician, the higher the chances of patient no-shows. And no-shows cost practices money. Forget about those days when you used to bill $25 for a patient to pay for no-shows if they cancel the appointments within 12 hours. It's a bad practice. It's a bad customer service. You cannot do that in today's environment where there's a lot of competition around you. So it's not a good practice to charge them for no-shows for any reason. There might be an emergency, they might have forgot. But you can certainly do few things with the help of technology where you can lower the percentage of no-shows in your medical practice. Because delay or difficulty in getting an appointment, it impacts patient perception for the overall practice experience. So you don't want people, when they call for setting up an appointment in your medical practice, you don't want to give them more than 1 to 3 days delay or more than 1 week's delay. That's not a very good practice. So effective patient scheduling has a direct impact on your practice revenue. Effective patient scheduling. How can we do it? Think about it. Technology is the obvious answer, but what in technology? What can you do with the technology? A lot of things you can do. Today, we will talk about 4 things. 4 basic, very important things you can do. First and foremost, like in my case, my obvious reason I missed out my appointments because I'm busy, I forget about it. Obvious answer. Why? Because doctor's office, either they don't call me for they don't remind me a day before my appointment. Even if they do, they don't send me messages all the time. If they send me a message, they don't send me a calendar link where I can set up an alert in my phone. So here I've given you some new tips. What can you do as a medical practice? What can you do? You can do following things. Set up a system in your medical practice where you can send not only the traditional phone reminders to your patients, but also SMS. You can text patients using technology with your computer, with the practice management system. There are different solutions available. Normally, it should be the part of your practice management system that in today's environment that you can text your patient. If it is not for any reason, there are third-party tools which are available. Sandbird is a new tool. It's a small tool. It's a subscription-based service. You can send and receive text on behalf of your medical practice with your patients. You can send them secure messages. So they're HIPAA compliant, send them secure text messages. So texting is a good way. Emails, alerts. In the email alert, if you're sending them emails stating patient that he has an appointment tomorrow, make sure you have a calendar invitation in that email so that he can create an alert within his smartphones. And he knows exactly an hour before there's an alert that he has an appointment with so-and-so practice. So use multiple channels for appointment reminders. Appointment reminder is not just a phone call. Use multiple channels. So phone calls, SMS, email, and then the 4th is you can set up patient appointment reminders in the patient portal. And not only the patient portal, if your practice management software has a feature of providing a patient app in the smartphone, like I know eClinicalWorks has an app called Hilo. So if you have educated your patients about downloading that app, and if they're using that app can give notification about medication reminders, appointment reminders, so many things. The patient is actually empowered when he uses an app for your medical practice, which is again provided by your practice management system. So check with your EMR company, practice management company, if they have a patient portal, they have a patient app which your medical practice can use. So the first and foremost, appointment reminder. So empower that area, create a new process, see if you have the resources in your medical practice where you can automate that by using a technology. So that's one thing which you can do. Second, excuse me. Second, actively manage your patient portal. So what happens when you have a patient portal, sometimes you don't use it, or your practice is so busy that they are still managing everything through paper and manual process. So you can automate all of that. As I said, if you have a notification app, you can send a lot of notifications through patient portal to your patients. Medication reminders. If they have a new labs, you can set up a reminder. Patient will automatically get notified. You don't need to do anything. Appointments, as soon as the appointment is made in your practice management system, patient will get the appointment reminder email automatically. So actively monitor and manage your patient portal. It's not necessarily that whatever the patient portal which was set up a year ago, you're still managing the same way. Look at more features it can provide. Talk to your practice management company. They might have added some new features which you are not aware of it. So actively manage and monitor your patient portal feature of your practice management system. That's number two. Number three, track appointment metrics. So MGMA has good benchmarks, but again, it's very simple. Track how many patients are canceling their appointments. Either they are informing your practice to cancel the appointments or postponing it, or wants to prepone it if you have a slot available. Also track how many people are canceling or doing no-shows. You can do it using your practice management system by pulling some analytics, by pulling some reports. It's very easy. It's called the appointment cancel or no-show report. When you pull that report, you would know how many people, when you call them to remind, they canceled at that time, or how many people did not show up. So that report is extremely, extremely important. So track patient appointment data, appointment metrics. And you can just set up a day, like once a week. You can just do it quickly for the whole week. How many people, what are the numbers, and what percentage of the practice patients they're canceling. There might be some practical reason. There might be some transportation issues. There might be some reason which you may not be aware. But you would know when you would see that data, because there is a cancellation reason in the data, which you can actually notice. And you would know what kind of patients are actually canceling their appointments. Are they new patients, old patients, a follow-up appointment, existing appointment, what kind of appointment it is. So very important to track practice appointment metrics. So track the data, look into the reports, appointment no-shows report, and see if they tell you something. So that's the number three. Number four is very important. Educate your patients about using telemedicine. I was looking into the latest Medicare 2021 fee schedule. They have added nine important consults, 9 important diagnoses. You can see patients permanently through telemedicine. So that's a very, very 9 codes. So you have 9 new codes in telemedicine where you would see those kind of patients through telemedicine forever, for now. So look about this. I mean, think about it. Telemedicine is going to change the entire face of your medical practice. So you have to set up, you have to listen my previous conversation, what you can do to set up a nice telemedicine room. So like today, you see, I have set up this conference room. I have converted this into a telemedicine. It's a camera. I see the large screen right there, and you can see me clearly. So set up a good telemedicine equipment, but most importantly, educate your patients. Tell your staff when they call for reminders, call for appointments, they educate your patients about using telemedicine. So if you're sending a notification in the smartphone, if you're sending a link for your patients in the SMS or as a SMS text, they should be able to click on it and see you like this on the camera live without even remembering their passwords or anything. So it's a technology your practice management system should be able to provide you and get you set up. But as a practice, it's your job to educate your patients how to use that technology. So it's not just the technology, but your staff has to educate your patients how to use it. So with these 4 things, I think we have touched upon some amazing ideas today. I hope you will take care of yourself. I hope you will take care of your patients well. Well, take care and stay with me for the next webinar. I will be talking about something new, but let's see how much you can implement what we have talked about it. And if you have any question, come to our website, practiceforces.com. You can always chat with me. Follow me on my Twitter. Our Twitter handle is Practice Forces. You can also look at our video channel on YouTube, which is Practice Forces, which has a lot of these videos which can help you running your practice smooth. So thank you very much and have a wonderful weekend, guys. Thank you.